Hi everybody, thank you so much for joining our webinar today. We're going to get started with our deep dive on steps therapy reform and talking all about the amazing work that you've done so far and where we can go from here. So we're going to step into spring together with some awesome advocacy opportunities to celebrate this amazing step therapy reform introduction. To kick us off, we'll do a quick round of introductions. My name is Julie Eller, and I manage our grassroots advocacy programs at the Foundation. I get to help all of our volunteers around the country connect with ways to share their stories with their legislators and decision makers.
Hey everybody, I'm Vincent Basilio, Director of Federal Affairs, and I work closely with Congress and the Executive Branch.
Hi everyone, I'm Stephanie Livingston, Consumer Health Specialist for the Advocacy team here in DC. I'm excited to be here. So getting started, we wanted to give you a look at our state director map. So be sure to take a moment, find your state, and take down your state director's email address. We encourage everyone to connect with them via email if you haven't already, to see if there are any additional local advocacy or other opportunities that you can take advantage of. So take a minute and find your state director. Moving along, we wanted to highlight again our virtual summit campaign that happened in mid-March. We had over 10 million impressions on social media that we were really proud of. And we wanted to just say thank you to everyone that participated. Here are a few of the tweets that we pulled from social media. We even had some dogs that wrote their arthritis story. So we wanted to say thank you to everyone that attended the summit in person or virtually and shared their story. Our main topic at the Advocacy Summit was step therapy reform. And because of all of this hard work that all of you have been doing, we're very proud that our step therapy reform legislation was introduced in the House of Representatives last week. So we'll be talking about that a little bit more today, but we're really excited about the momentum we've created here.
Thanks, Stephanie. So to talk about step therapy reform a little bit, I think we should take it back a couple of steps and talk about what exactly step therapy is and why it's an important issue for patients across the country and what we can all do to help. So like Stephanie said, we helped to bring patients together at the Advocacy Summit to really raise awareness for the patient faces of what step therapy is and how it can be burdensome to patients. So let's talk about the process a little bit. Step therapy is also known as fail first, and it's a practice that's used by insurers that requires patients to try an insurance-preferred medication before permitting coverage for the treatment originally prescribed by a doctor. Now that's a little bit wordy, so let's take it step by step. What would happen is a patient of any disease state can go to their doctor and describe their symptoms. And together with their doctor, they decide on the best form of treatment for those symptoms and for this disease. The doctor would prescribe the best medication to fit those needs for their patient. And the patient would take their prescription over to the pharmacy or call their specialty care pharmacy and say, hey, I've got this prescription, can you help me fill it? And the pharmacy would check in with the insurance company. And unfortunately, frequently the insurance company has a preferred medication that might be a lower cost drug or an older drug that they would rather their patient tries first before taking the medication that their doctor had prescribed so that they can reduce costs or manage the care a little bit. So what would happen instead of getting that doctor-prescribed treatment is that the patient would receive this insurer-prescribed medication regardless of whether it was going to be most effective for them. And often they have to fail that treatment first before accessing that preferred medication by their doctor. So what happens to the patient in the meantime? Well, if they have arthritis, they might be experiencing joint damage or having an accelerated pain progression or having a limited quality of life as a result of this treatment that they've been asked and required to fail on. And while that happens, the face of the patient can totally change, and the presentation of the patient can totally change. And in most cases, or in some cases, patients really experience the brunt of this before they're granted access to that doctor-preferred medication. And oftentimes, when they get access to that preferred medication, they turn around their treatment. They really respond well to the treatment, and it can be really helpful for them. And this doesn't necessarily only apply to patients with arthritis, although it is a major concern for all patients with arthritis, whether it's an autoimmune arthritis whether it's an autoimmune arthritis or osteoarthritis or juvenile arthritis, whatever your specific diagnosis might be, we see that this happens for patients quite frequently. And to couple with that, our patients with arthritis are often experiencing another disease along with their arthritis, and step therapy can happen in those other disease states as well. So if you have this idea in your head that step therapy only happens when you're being prescribed a biologic for a lower cost alternative, erase it, because there are some other disease presentations that would be going through step therapy as well. And even, let's say you have osteoarthritis, before being prescribed a treatment that would help you control some of your swelling and some of your pain, you might be asked to try and fail or prove that physical therapy wouldn't be used to effectively manage your care before getting access to that prescription that's so necessary for controlling your pain and swelling. So if this wasn't an easy enough kind of demonstration of what step therapy might be, we wanted to introduce you to the chair of the Maryland Advocacy Committee, Katie Roberts, who has a really compelling step therapy story, and she actually wrote about it on our advocacy blog just last week to couple with this action opportunity that we have for all of our advocates. But Katie Roberts was prescribed a life-changing medication in the form of biologic in the early 2000s, and it helped change her prognosis from one where she really was having an inability to go to work. She wasn't able to really have this high quality of life that she wanted as a young woman in her early 20s until she had access to this biologic. And she was stable on her care with this biologic until one point at the middle of their plan year when their insurance policy changed. And her insurer had asked Katie and her doctors to take a step back and try a lower cost or older medication that was preferred by the insurer before they would grant coverage for this medication that she was having before. Unfortunately for Katie, within 4 weeks of going off treatment, she was back in a wheelchair. It had only taken her 4 weeks to go from fully functioning to really experiencing these negative impacts of not being on the appropriate treatment. And some of the elements of her story that are really compelling show us why step therapy reform is so important. For Katie, in her story, the process that she went through with her insurer was not transparent. There were no stipulations on how long Katie might have to try and fail any of these preferred step therapy medications. She really didn't have an avenue to see what she needed to do to help to circumvent some of this process. Her doctors didn't have any power to appeal or to override the decision, even though it might have been medically necessary. Her doctors were trying and failing to appeal the insurance decision, but really did not have any luck in helping her get the treatment that she needed when she needed it. And finally, Katie's health plan did not take her medical history into account. So although the treatment that she was using was also helping to control her other comorbidities like psoriasis and Crohn's disease, her insurer still wanted her to try this alternative medication instead of keeping her on this medication that was keeping her stable. As a result, Katie had 14 surgeries, countless doctor's appointments, countless opportunities to miss work and so on, and it was a really negative thing. But the moment that she was able to get through those step therapy protocols, she was back in a position where she was able to return to work. And her story really helps illustrate our principles for step therapy reform and why they are so important for people with arthritis.
So let's dive a little bit more deeply into those specific principles that Julie was talking about. We tried to drill them down to three really basic, broad principles that apply to a lot of our work at the state level that you'll hear about in just a second, as well as to the federal level and the new step therapy bill that Julie and Stephanie talked about. So the first kind of key patient protection to think about is that step therapy processes and other insurance processes like it should be transparent. And unfortunately, that's not always the case today, where it's often difficult to find the right forms, and your doctor or you have to go digging a little bit to find out what the right process is to go about contacting the insurance company to ask for an exception. So that's kind of the key thing to remember first, is that step therapy should be transparent. The second, as we alluded to earlier, is that providers should be able to override a step therapy decision in certain situations. For example, the provider is always in the best position to know what a patient's prior medical history was and whether they've been successful in receiving treatment from certain drugs compared to others, whether they've had side effects as a result of trying certain medications, and whether there are any sort of contraindications due to medical drug interactions. So we want to make sure that providers have the ability to override the insurance company in this process. And the third and final patient protection to keep in mind is that health plans need to follow a clear and timely review of step therapy override requests. So often what can happen today, especially in employer-sponsored plans, is if there's a step therapy protocol in place by an insurance plan, there's really no timeline around how long it would take them to get back to either you or your doctor about whether they've allowed an exception to go forward. And so this legislation, as well as a lot of legislation at the state level, puts in place time parameters to make sure insurance companies get back in enough time. So with that, let's take a look at some of our step therapy wins in the states. We're very excited to share that Oklahoma this morning became the next state on our win list here, and so we've highlighted that in green today. I think we're up to 23 states now that have passed step therapy reform. And so you can see that the map is really filling in with that darker green. So we're still deep in legislative sessions now at the state level, with several states in that lighter color actively considering legislation. So we're hopeful that we'll add a couple more to this list as we go. So before we move on, you're probably wondering, why are we showing the state map? And it's a great question. We have a ghost, guys. Hold on. All right, going back. So, the reason why we are showing the state map is because all of these state bills are really important to cover the insurance within the state lines. So each state has their own insurance commissioner who monitors insurance plans that are regulated by states. So that could be anything from small plans or individual plans to those regulated on the individual insurance market and that are purchased on the healthcare insurance exchanges that were put in place under the Affordable Care Act. So those state bills are still important, and what we're trying to do is harmonize the state bills with the federal legislation, and we're just trying to make sure we cover everybody. So the federal bill deals with employer-sponsored insurance, because there are about 180 million Americans that get their health insurance through their employer, and we want to make sure they can benefit from the state legislation that's already been passed. So with that, we want to talk a little bit more about the federal bill specifically that was introduced last week, as Stephanie mentioned. The bill is the Safe Step Act, which is HR 2279, and it implements just what we talked about a few minutes ago, common sense guardrails around the use of step therapy. So those time bands and making sure insurance companies can get back to you in a right amount of time, making sure it's a clear process, and making sure that it's transparent. So we touched on some of the items on the right on the screen that are around the federal step therapy reform kind of principles that we also look to at the state level. To look on the left side now for another moment, we can see that the bill was introduced by Representatives Brad Wenstrup and Raul Ruiz of California. So this is a bipartisan bill. and they have unique interest in this because they're both medical doctors and have experienced step therapy requirements during the course of their own practice of medicine. So they are intimately familiar with the issues that come about with step therapy and understand the burdensome process that it is today. So we wanted to provide you with some additional background from the prior Congress as well, in that next bullet, or number, excuse me. So last to Congress, the bill was called the Restoring the Patient's Voice Act. And so the bill title changed just a little bit, but the important thing to remember here is that in just 2 years, we were able to build up to 88 co-sponsors in the House of Representatives. So I know it doesn't seem like a lot when there are 435 members in the House, but that's a really strong showing, having considered that the bill was only around for one session of Congress, and one session of Congress lasts 2 years. So we've got great momentum going into 2019 and through 2020 on this new bill, and we're really looking to you all to raise your voice with us to rebuild the co-sponsor list over the next couple of years and meet the 88 number and then far exceed it. So we're really excited about that, and let's move on to the next slide.
Great. So we wanted to go over an awesome tool that we have in our Action Center on the website. So if you go to arthritis.org/Action Center, there's a great tool under Track Legislation that allows you to look up everything you may need to know about any of our active legislation or legislation that we're following on either the state or the federal side. So if you click Track Legislation right there in the left-hand side, sorry, it's sleeping. There we go. Right there on the side, you'll see a window that comes up like this, and you can either, you see HR 2279, the Safe Step Act, down there at the bottom, or you can type in step therapy in the keywords section. You'll see both of those come up. Click either one that you'd prefer, and then you'll see some more information about the bill. So you can see Congress's description of the bill, and then whether we support or oppose it. Of course, we support this bill. And there's a description that you can see about what step therapy is, what this legislation could do for arthritis patients. And then moving on, most importantly also, is you can look at the co-sponsors of the bill. So currently it is the two representatives that Vincent just mentioned, and you can look at the actions and see kind of where it is in Congress, if it's moving forward or if it's still being looked over and things like that. And of course, you can look at more information on the bill's direct website with Congress. So this is a great tool that we recommend you use to stay up to date in between webinars and things like that. So be sure to check it out at arthritis.org/Action Center.
Yeah, and the reason that this tool is especially important for each of our advocates to take a look at is because as you share your story, we're not just hoping that you send a letter to Congress to raise awareness. We also want to make sure that we get to a point where your members of Congress are responding by adding their names. And so one of the things that you can do as an empowered advocate is take a look at this list of co-sponsors. And as you engage with your member of Congress, if they say, yes, of course, I would love to be a part of this legislation, I'm going to reach out and I'm going to sponsor it, this is our feedback mechanism. This is how we can know for sure that our members of Congress are supporting these important asks that we're making of them. So take a look here and make sure to see whether or not your member of Congress is signed on as a co-sponsor as you ask to hold them accountable. And it's also a really cool tool because you can see where the bill is in progress toward becoming a law. So right now, you can see that it was referred to the House Committee on Education and Labor, and that's going to be the committee of jurisdiction that has the most power over how this law how this bill progresses through Congress right now. So if you take a look at the list of people who are on the House Committee of Education and Labor, and they happen to be one of your members of Congress, Your advocacy is so important on this issue, because the more that we can create a sense of urgency for them, create a sense of importance about this bill, the better off we'll be at making sure that this bill has the momentum that it needs.
And to build on what Julie mentioned, committees take note when bills gain a lot of co-sponsors, because that means that it's a priority for a large portion of the House. And so that's why I mentioned earlier that it's important to meet and then exceed those 88 to 89 members that co-sponsored in the last Congress.
Right. If you want to know more about who those members are, we do have a list of them on our website, so you can see, oh, my member of Congress was a sponsor last Congress. I just need to connect with them to make sure that they re-up their sponsorship on this particular bill. So we have a lot of power as advocates to make these things happen. And the main avenue that we're asking our advocates to use right now is our action alert. We have an action alert that many of you on the call, I know, have already sent a message through to their member of Congress on, and I thank you so much for doing so. But the work is not done with just one message. We've had a tremendous amount of support here, and it allows us to share with our members of Congress that this important legislation has been introduced, that we're hoping that they sponsor this legislation, or if they are already a sponsor of the legislation, it will send them a thank you message accordingly. All you have to do is type in your address, and it'll populate the appropriate message for you to send to your representative. But for many of you, you've already taken action. So what can we do to expand on this action? Well, we're hoping that you will share this action alert with your communities. Post it to Facebook, post it to Twitter, send out an email to your friends and family, shout it from the rooftops, look at your Monster Arthritis. We want to make sure that the word gets out. So the easiest way to share this action opportunity is by sharing this following link, bit.ly/HR2279SafeStep. It'll be a direct and short link that you can share on Facebook and on Twitter and on all of those different platforms to make sure that your community sees what you're doing to advocate for arthritis and helps you double down by sharing their stories as well. The other thing that you can do to make your messages incredibly impactful is to modify your message using the message body feature of the action alert. And we're really, really proud to say that more people have modified and personalized their messages on this action alert than ever before. We wanted to give you some examples of how personalizing your message can really make an impact. And what we wanted to mention was we've had tremendous success with passing these state step therapy victories across the country. In Oklahoma, we had victories where people were personalizing their messages to their legislators, personalizing their messages to their governor, and encouraging them to sign the legislation, to pass legislation. And that is what makes advocacy possible. So congratulations to the folks who've had victories in this past year on step therapy. Oklahoma, Virginia, our Georgia advocates have been working really hard. And here are some examples of some of the things that they've said. One of my favorites here is that every time my company changes insurance plans, I am at risk of having to start at the beginning again in regards to step therapy. Passing the state law will help their doctor prescribe the medication that they need to keep them on their feet and working at their very busy job. This is just 2 sentences. It's just 2 sentences to personalize this message that includes all of the legislative wonky asks that we might have had at the beginning. All we need from you is to say, this is my patient story. This is what happens to me in my quality of life if my care is delayed. Here's a story about the administrative burden of navigating my step therapy requirements with my insurance company and why that was burdensome for me. It can be short and sweet. The most important things are that they're honest, representative of your story, of your child's story, of your parent's story, to make sure that our legislators can have that space to put the person behind the policy that we're asking them to support. And if you aren't super comfortable or you're asking your friends to take action and personalize their message, one thing that you need to know is that in our messages to Congress on this particular action alert, we've included Katie's story. We've included Katie's story right in the message body. So if you're asking someone who really doesn't have a step therapy story to take action, but does find this issue important to them and wants to share their story on behalf of, you can rest assured that Katie's story will help to create that sense of empathy for the legislator, and that modifying and sharing a couple additional key insights for you or for that sender will be a really great way to generate some buzz. And here's something that we're really, really proud of. So far, this bill was introduced just last week, and already we've exceeded, just during the time that this webinar has gone live, we've exceeded 500 letters to representatives about the importance of this Safe Step Act. And that's in addition to the work that we did at the Advocacy Summit with the virtual advocacy campaign, with our previous step therapy alerts that we've had going live about the importance of reform. Just on this alert alone, we've had 258 members of the House reached. So of the 435 members that could be reached, we've reached 258 of them, and that is something to pat yourself on the back for. You can see in this map here, this outlines each congressional district, and that's why all of these lines are a little bit jagged and funny to look at. But you can see here that any of the districts outlined in blue are districts that we have reached. And in gray are the districts that we have not yet had action taken. So you can see where it's especially important to expand our advocacy. If you live in California, shout it from the rooftops that we need some help. We want to reach Idaho and Wyoming. We want to strengthen our light blues into darker and darker blues across the country to make sure that we're really reaching each individual representative with this important message on step therapy reform. So what are you tasked with? A couple of things. Growing this number by engaging your communities around you and asking them to help us take action. If we can get all 435 representatives at least one message about this step therapy reform legislation and the importance of co-sponsorship, we will be really doing our part to raise awareness on behalf of this important legislation. But let's expand even further. If you match this action against looking at our bill landing page and looking at this list of co-sponsors that we have, and use this action alert to re-engage with those legislators that you've connected with maybe a month ago or 2 months ago now, and making sure that they get this message reiterated to them, we'll be in really good shape. So consider sending in your messages, and as you do, we'll channel them and couple them with the work that we're doing when we go and visit members of Congress in person in Washington, D.C. We'll couple this with a lot of our efforts around August recess visits later this year, and we're hoping that we can grow this action and this community of people who are taking action from the 500 letters that we've had right now to more than 1,000, so that we can reach all of our representatives in Congress and really enforce for them that it's important to sponsor this legislation and get it across the finish line. So please share, 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 and take action with us so that we can get our voices heard. An additional thing that we wanted to plug for you is that our awesome online community forum is having a dialogue next week on insurance challenges. And the dialogue is a part of our hot topic push around dialoguing and discussion on the online forum. So if you haven't joined the forums yet before, we want to encourage you to log on and create a profile. Next week, when you come onto the forum, you'll see this hot topic go live on insurance challenges, where we're encouraging folks to share what they've experienced, if it's a step therapy story or a prior authorization story, trouble in open enrollment or anything like that. You can ask your questions of our experts. Our boss, Anna Hyde, is going to be on the line to share with you some of our inside policy tricks. Heidi Barrett, Platinum Ambassador from Washington State, will be on to talk about her personal experiences and how, being in the shoes of the patient, what she can offer to other patients who are experiencing similar things. And we'll also have Christina Reed of the Ohio Department of Insurance to talk about some state-regulated plans and ways that you can engage with them. So, as the next step, you can also check out this awesome hot topic discussion thread just next week. We want you to stay tuned for some future webinars. We'll have our upcoming webinars on May 15th, June 19th, and July 10th, again at 11 a.m., just as we have here. and you can go to our website, into our Advocate section to register for these webinars right now. You can also expect to see information about them in our upcoming Advocacy in Action blurbs. To close us out today, we're right at 11:30 now, so if you have a hard stop, please feel free to hop off the line, but if you don't, we'd love to take your questions. So please feel free to chat them in to our chat feature or into our Q&A feature, and we'll be sure to answer them with our experts in the room. That's a great question. So one that came in is, how can we share this important information with other representatives that are in our not in our state, but not necessarily in our district? There are a couple of ways that we can do this. At first, you'll know that our Action Center pairs you with a letter that will only go directly to the representative who represents you in your district. But some of the things that we can do really call on our communities. We can share that Action Center link with the friends and family that we know live in those representative areas in your other parts of the state. And the reason that we do that is because our representatives are here to listen to their constituent voices. They want to hear from the people who live in their neighborhoods. One of the things that is a really great way to engage with the other reps in your state that we're working on right now is by going to your local Walk to Cure Arthritis event and visiting your advocacy booth there. At each advocacy booth, we're having petitions available to be sent to the representatives in that state that would allow them to see all of the support for the step therapy reform legislation and how they can help. So we'll be sending off those signatures to their members of Congress across the state so that we can make sure our voices are heard. So twofold answer: make sure you're connecting with the people around your state to make their voices heard through our Action Center or beyond. And let's make sure also to take a look at our advocacy booths at the Walk to Cure Arthritis. Help to staff the booths if you're interested to make sure that we're collecting those petition signatures as well. At the end, when we are done collecting any questions, we'll post again the webinar dates for the next WebEx. We're not seeing any other questions come in, so with that, we encourage you to reach out to us by email. Reach out, we'll be happy to answer any of your questions. Talk with your state director, talk with our team. We're happy to help you take action. We want to make sure that you get this link one more time before we close out. Make sure to visit bit.ly/HR2279SafeStep to share this important action alert, to share all of this important information with your members of your community, and to continue taking action with us. We're at 500 letters right now, and we can continue to grow that momentum with all of your hard work. So thank you so much for joining us today. I'm going to pop up our briefing dates one more time so that you can take these down. Remember to visit our website, to register for these important webinars, and keep an eye on your inbox to see them directly in your Advocacy in Action. As you close